And a lot of times the issues are nothing to do with actual healthcare. It has to do with water shortage. It has to do with the air they are breathing. It has to do with the fact that they don't have a roof. The mental health, the fact that, you can provide transportation to go to primary care, but they can't go because they have 4 kids who's going to watch them. So there's so much that goes on around a person that nobody's addressing to, which is why they end up the way they end up in the ER, because a lot of the non-funded patients, unserved patients, underinsured patients, they wait till they cannot do anything more to come to the hospital. So most of them are hanging by the thread.
And welcome back, Rio Grande Guardian viewers. Pleased to have another podcast here in the studio today. And my very special guest, Rashmi Chandran, who is Executive Director of AltaCair. In today's conversation, we're going to learn a little bit about Rashmi and a lot about AltaCair, I hope. So, Rashmi, welcome.
Thank you. Thank you so much for having me.
So, I've been encouraged to ask a little bit about yourself, your professional education, your career, and how you arrived in the Rio Grande Valley.
Absolutely. So I was born and raised in Mumbai, India, very metropolitan, fast-paced city. My dad is retired now, but was a government employee, worked for a setup which was similar to the Pentagon in U.S., so he was a nuclear scientist. So was blessed to be in a middle-class family, very educational-focused family. My older sister's an engineer, so in our household, there was 2 options for career. Either you become a doctor, if you're bad at math, or you become an engineer. I was bad at math, so I was pushed into the medical industry. However, I wanted to be a journalist. That was my passion. But anyway, so medical, healthcare, taking care of people, that is how more or less my mindset was driven right from a very early age. Mumbai has 2 colors to it. There is a very sophisticated, economically developed, fast-paced side to it, and then there is a lot of poverty and extreme deprivation of even basic needs to it. So I was kind of exposed to both in different aspects of my life. One, I was a Girl Scout, so got to do some, voluntary work there. And it was eye-opening to see that how much people don't have, and they are still surviving. And there's so much disparity in the economic levels of people living in the same small city. So when I started practicing in the hospital there, I completed my doctorate in physical therapy. That's the route I went. And I was working in ICU in one of the hospitals in India. Again, the same thing. There was one patient who had all the economic benefits possible and was able to have the best care in the same room. And there was another patient who had absolutely nothing. And considering the health system in India, if you're not able to pay, there's only so much you get. And the reasons why patients would get to the hospital, especially when they are in the lower strata of the social level, was something so avoidable. So patients are coming in just for a small cut that turned into an infectious leg and they're getting amputated, right? So all that disparities really hit me right from the time when I was in India. I came to the United States about 14, 15 years ago. My first destination was Florida. I was in Tampa, did my MBA in healthcare administration. I felt like growing up again, seeing where clinicians can do certain things, I felt like administrators can make more of a difference. So which is what was my motivation to go into hospital administration. So hence the MBA in healthcare administration. Post that, I did a brief internship in Mayo Clinic in Jacksonville, Florida. It's a very big non-for-profit hospital system, however, a little too big for an intern who is coming from a foreign-trained country. So it somehow didn't click as much. So that's when I started my search on Indeed.com, where there's more opportunity. And Brownsville, Texas kept coming up. And it just seemed like a lot of job opportunities in administration in Brownsville, Texas. Now, I had no clue where Brownsville, Texas was. I Googled it, and it looks like it's in Mexico. So my family said, no, you cannot leave the country. You have to live in U.S. But one of the employers did contact me and say, why don't you visit the place? With all these misconceptions people have about bordering cities, it will go away once you visit. So I did take that opportunity. I had an open mind and heart. So I came down. I was picked up from the Harlingen airport, taken directly to South Padre Island, and told that is Brownsville. And so I was like, this is like Clearwater. Yeah, I will move here with a great package, great, career ladder. So that's how I came to Brownsville, Texas, and later on realized that that was South Padre Island, and this is Brownsville.
Slightly different.
Very slightly different. But Cameron County, Brownsville, is where I started my journey with the doctor's office, who was a pain management specialist. His wife was an internal medicine doctor, so managed the setup, learned about all the, insurances, coding, the billing processes, everything which is so different from a lot of the other countries. That was the stepping ladder for the RGV career. From there on, what I realized is you need to know Spanish. You need to understand the culture here, which is also very different from what you think about the U.S. when you are living in another country. So the diversity of it, the fact that Hispanic culture was so close to Indian culture, that it was amazing. It also needed a lot of adjustment because I was from a bigger city, used to speaking only in English, not even Hindi that fluently, to be honest with you. But, good change, learning curve, then moved to the Upper Valley, worked for a hospital system there. And thereon, being mostly with hospital system, now going on almost 13 to 14 years. Every year, the love for this community kept growing because I just felt that this is the best of both worlds. You get the same cultural feel that you felt in India. You get the best of the food that, is sometimes better than Indian food, and not maybe healthier than the Indian food, but better than Indian food. You get to live freely. You get to explore an opportunities because there's a lot of gaps here. So if you want to try something new, this is the place that welcomes new opportunities. So traveled a lot of places in U.S., outside U.S., but this always felt home. Even after vacation for 3-4 days, it just felt like it's time to go home, and this is home. So reached that point over the years. But really the warmth that you get from people, and despite of having several cities and 4 counties in such close proximity, which is rare in other places, I think everyone's close-knit, and ironically doesn't feel like borders matter.
I was going to ask, when you say that maybe the Indian culture is very similar to the Hispanic culture, included in that would be how close-knit the families are, more so perhaps than in the United States. Would that be the case?
Well, in some way, yes. I think in the Indian culture, there's a lot of effort given to work ethics, which I see in here, that you have to work hard. If you want things in life, you have to work towards it. So I see a lot of people echoing that here. Togetherness and companionship definitely is something that is very similar here. I think, taking care of our elders is given a lot of importance here, which is of huge importance in India. Like if your parents are old and you're not living with them, you are looked upon very badly there. So I think I see a similar kind of culture here. And then the colors and the dance and the laughter, the hugs, all of that I think is very similar.
That's wonderful. It's great to hear this story. Thank you for sharing that with us. So time to move on to AltaCair. And I have to say that AltaCair for me just came out of the blue. And you'll remember you had that big forum one day, and I was not sure who you were as a group, and it seemed it seemed like lots of glitz and glamour for me. It seemed very polished, lots of it was really well managed, stage managed, etc. And I thought, well, this must be a corporate America thing. And it wasn't until towards the end of that day when you gave us the opportunity to meet some of the speakers, and then you heard where they were coming from, where their passion was. And I came away and spoke to a reporter friend of mine. I said, actually, no, these are the good guys. This is a group we need to follow, because they were concerned about access to healthcare. So it wasn't the profit driven, etc. So tell us about AltaCair. How did it start? What made you set up here in the Valley? Because I think the viewers would love to hear about that.
Right. So my career was mostly in mainstream hospital healthcare administration. Because of my doctorate in physical therapy background, a lot in rehabilitation and therapy services. But I got this great opportunity to switch to value-based medicine, which focuses on population health, health equity, access. So in that role, there was so much exposure, again, into the social determinants of health or non-medical drivers that lead to health issues for the patients. Digging deep into the ER, emergency room population, and just even hearing some of the assessments and examination that providers do. It's again, heartbreaking, the similar story that I grew up hearing, right? And a lot of times the issues are nothing to do with actual health care. It has to do with water shortage. It has to do with the air they are breathing. It has to do with the fact that they don't have a roof. The mental health, the fact that, you can provide transportation to go to primary care, but they can't go because they have 4 kids who's going to watch them. So there's so much that goes on around a person that nobody's addressing to, which is why they end up the way they end up in the ER, because a lot of the non-funded patients, unserved patients, underinsured patients, they wait till they cannot do anything more to come to the hospital. So most of them are hanging by the thread. So that led to the other whys that followed is like, why is this happening? Are there not enough non-for-profits? And the answer was yes, there are about 300 some non-for-profits here. Okay, so do the people know they exist? So for once, the hospital definitely doesn't know that they exist. So the continuity of care when these patients are leaving, we're leaving them back to the life they have. So how is that preventing anything, right? So it's important for the hospital system to know. Now, the next question is, do the general people know? The answer is no, because if they would have known, they would reach out to somebody, right? Now, do the non-for-profits know each other? Again, the answer was like, not really. So there were so many gaps that were identified with the whys. The first step towards that to me was to let's bring it to surface that we don't know a lot of things. That's how Accelerator came up to being, which was a Health Equity Summit. And we also wanted to see a story there because 10 years, I think about 14 years ago, there was an article written in New York Times about Rio Grande Valley and how it's a healthcare scam and, still a diabetic capital, obesity capital. However, healthcare is so unaffordable. And it didn't put us in a good light. Even now when I travel, And I say I'm from
Everyone's
McAllen,
read that
Texas.
article, haven't they?
Yes. If they are in healthcare industry, they know about McAllen.
But Mr. Gwanda's written a subsequent piece and said that it has improved somewhat.
Exactly. So we wanted to bring that up, and our keynote speaker at that time was Anish Chopra, who was the chief information officer for President Obama. So he actually showed the data that, yes, this is how RGV was, but this is now RGV is, which stimulated the next article saying that they have turned the page. So that was very important to us to actually, celebrate the changes that we've done, but also take that opportunity after that to say that, okay, that's good. Like, we celebrate it, but now hold on. We all also have all these issues. So primarily focused on healthcare access there, but touched a little bit on workforce issues. We had a panel with Judge Cortez, Ms. Veronica Gonzales, Manivela, and one of the representatives from WGU. So they touched some of the workforce issues, which also leads to access, but also leads to the point there that there's poverty. So that is how Accelerator came into being.
But let's go back one stage. AltaCair itself, was it formed specifically for the Valley, or did it already exist? And then you decided that this nonprofit decided the Valley's the best place for us to do our work?
It did not exist. Valley is the birthplace of AltaCair. Accelerator was the launch date of AltaCair Foundation. That was the day when we had sponsored the event, as well as we announced that we are putting this non-for-profit together so that we can address these issues.
And how were you able to get the funding initially to start it when you didn't have a track record to show that you've got any success or buy-in from the community as a non-profit? Was it all foundational money?
So, yeah, the summit itself was, again, us scrambling for sponsorship, putting some personal investments together to make the summit happen. And there were some generous donation made during the summit by our sponsors that went to the foundation, and that's how foundation got the kickstart
So you were really starting without a safety net, and you just had to prove yourself on that first day.
Absolutely. But the mission was so strong, and it spoke to so many people that so far it just, has gotten a warm hug from everyone.
An immediate buy-in.
Yes, absolutely.
Fantastic. So the next question I have, and I know we're going to talk about the clusters either with yourself or Veronica later. I'm very interested in that. But I would like to know, because apparently this is quite a new partnership, but you're working with the Hidalgo County Prosperity Task Force set up by Judge Cortez. How did that connection happen, and how is it going?
Yeah, so Judge Cortez was also part of the Accelerator event. So that triggered a lot of follow-up discussions with him. What are we trying to do? He's big on let's not duplicate processes, and so am I. He mentioned the Mental Health Coalition that he had put together, which is a big success. So this foundation mission kind of replicates that model where we want to connect everyone and cross-match the gaps. He did give me details about what the Prosperity Task Force is. One of his, the person who was helping him with the Prosperity Task Force, Thomas Garcia, is one of our board of advisors. So I got a little bit of insight into how structurally there are different committees that come together, which was amazing if I could just plug myself into it, and then we can work in tandem. And then later on, Mr. Mario Reina from Prosperity Task Force reached out and started involving me more in the committee meetings. And I think all the pieces of the puzzles just came together because I think we have the skill set to execute some of the plans that they have been working on. And we have the ability to pull the different entities who haven't come together and some of them who already exist and match them with the resources. So that relationship is just growing, blooming, working very well. We'll probably be launching one of our collaborative projects pretty soon in one of the colonias.
So within that task force, have you joined an existing committee, or has the task force said, you just take care of that, you are your own committee?
I have been so far a part of the different committees. One of them has been the Water and Food Shortage Committee, and the other one has been the Healthcare Committee. I think those are the two where I fit in the most, because that is what we're focusing on too. So, and most of the members, I'm familiar with them, so already have a good working relationship. So we just have to connect what we have with what's being done, and then move together and work as one team.
So one of the successes I heard about, an early success for the task force, was I think it was just simply a piece of software that allows, and you were speaking earlier about how a patient might leave the hospital and not know what sort of support systems out there. Lots of non-profits, but the patient doesn't know, and even the hospital doesn't know. The task force, the health committee, was able to plug into something. It may have come out of New York, whereby all these non-profits that they're not related in any way. One might be concerned about maybe a clinic.
Yeah.
Another is a potential transportation service. But when that patient leaves the clinic and they say, well, what do I do about this?
Yeah.
They're now talking to each other,
Right.
which was never happening before.
Exactly.
And you're aware of all that.
Yeah. So the platform I think you're talking about is Unite Us.
That's it.
Yeah. It was able to get some insight on that, saw a demo, even spoke to a couple of non-for-profits that's using it. Definitely a great use of a digital tool, enhancing communication. I think where we can push that a little bit more is by ensuring more people use it, because the power of that tool only increases if others are also using it. The number of users is what makes that communication strong. But definitely that solves one of the issues that ties to the follow-up for the patient, and also in a very compliant way, because it's a very HIPAA compliant tool. So that is an excellent initiative that the county has brought.
Well, I know Mario Reyna will be pleased I asked that question, because he's always been pushing me to
cheerleader for me. I don't know him that personally, right? We've only had work conversations so far, but
he's very impressed.
But the support he provides is so invaluable.
Good.
Thank you so much.
And so I think I'm getting a message from the producer. If you can just slightly bring the microphone towards you a little bit.
Me towards somebody.
Whichever you prefer.
Yes.
Okay. And so I did go to one. We're going to talk about the clusters later, like I said. But one of the cluster meetings, you announced that your pilot program was going to involve the Rio Grande Valley colonias, or Hidalgo County colonias. Tell us why that is, why you chose that particular area, and what you hope to achieve in connecting the groups that do work in the colonias.
Right.
What's the goal there?
So the term colonia again came up, and the research came up when I was trying to really see what is the best way to get data on the underserved areas, right? I'm big on data. So that's when the Scholar article came up, which is a research, very helpful research done by UTRGV. And that's how I got even familiar with the term colonias, right? And it basically means a subdivision or a community that lives together. But living in cities like Edinburgh, McAllen, we don't feel like there will be areas where the houses are made of plywood. But that research actually brought into surface that there are really bad areas where no one can go in. So those are the areas where we want to help, because there are non-for-profit work that has been done in a lot of other colonias. But it just happens when there is a help center at one place. It's just that 10-mile radius that keeps getting served over and over again. But there are other areas in the perimeter which does not get touched. So we want people to expand their services there. So that's why, that was our mission, to touch the unserved colonies.
I know I've been lucky enough to go to some of your meetings, not all of them, but the one that the standout remark for me was when Eddie Olivares from Hidalgo County Public Health Department said the biggest impediment, the biggest problem is the housing, the substandard housing, and he painted this very graphic picture of tarpaulins and plywood and pallets all put together, and many people would have thought that disappeared years ago. People thought, well, we fixed that issue, but no, it's still prevalent because the colonies keep growing.
Right.
And I think you told us at that meeting just how many we've got.
Yeah.
But that was very profound for me, what he was saying. For those of us that do not live in colonies to know that's the level, the standard of living we have.
It is. And especially when there is like weather turbulence, like right now, the preparations that we're doing to dodge Hurricane Beryl, imagine those places, like what are they going to do with one sandbag? Like they live in such fragile condition. What are they going to do? They don't even have a vehicle that they can just get into and, escape should things get bad, because those roads are so bad that you probably cannot even drive properly on that, right? There is no broadband service there. So how quickly can even help get there? If there's a fire in one of those housings, a lot of times the fire station does not get alerts because it again doesn't have those fire alarms, which signals these things. So there's just like so many things that are unresolved, and it exists right around us, maybe just 1 or 2 blocks away, and we're not aware.
Mm-hmm. And I know the Prosperity Task Force, another of its big initiatives is to get more public transportation into the bigger colonias where they do have proper roads, not dirt roads, and that's considered important for going to school, visiting the doctors, even going to a supermarket to get good food. Sure. So that's one of their initiatives.
Yeah,
which will tie into your work as well.
Right, and Food Bank is also a great partner in that. I think the approach about transportation, also understanding that sometimes it is not about bringing people to us, it's about us going to them and them opening more satellite and mobile centers is also very helpful from a food perspective.
Good. Well, we're going to probably stop it there. We're going to bring Veronica Gonzales, who's one of your board members. But before that happens, you have an opportunity now to tell the viewers why AltaCair matters. What would you like to tell them? And what are you looking for help? Where are you looking for help? What can people do to assist your cause?
Yeah, so I think any help, I'll take it. This is a very exciting venture for me. At the same time, I've always worked for corporate companies. I've been in for-profit world, so non-for-profit space is new to me. I am almost about to finish school with Cornell University for a degree in non-for-profit certification. So I feel like it was important for me to do my part about learning more in that space. But if you are barely hearing about us, then we don't know you, and we want to know you. We want to know every entity across the 4 counties, not just one. So Cameron, Hidalgo, Star, and Willacy. And we want a cross-county connection because what Star might have, Hidalgo could use. So reaching out through social media, through our website, through email, anyhow that you can reach out and tell us what are the gaps that are not being worked on, because that's what we want to work on. So knowledge, data, connection, that is what we're asking for.
Fantastic. Well, thank you so much, Rashmi, for coming in. We certainly learned a lot.
Thank you. Thank you so much for having me.
Thank you. And we are back, Rio Grande Guardian viewers, for part 2 of our discussion about AltaCair, the AltaCair Foundation. And I'm very pleased to be bringing in one of the board members for AltaCair, Veronica Gonzales. Veronica, great to see you again.
Nice to see you, Steve. Thank you so much for giving some attention to this wonderful organization.
Mm-hmm. So we're going to talk a little bit about the clusters. You've had a series of meetings. You're bringing groups in that should be connected in different aspects of AltaCair's work. Tell us what those clusters are and the success you've had in bringing these people together.
Well, first of all, when we had our strategic planning meeting initially, we talked about how we always seem to assume what people need, but we really don't know until you ask people that are in that industry, on the ground, and then discover where the gaps are. So we decided to do some listening sessions and to bring in people from the education world in one, from government in another, from business in another, healthcare, and then I think faith-based was the other one, and then the nonprofit world. And so these cluster groups were overseen by different board members or advisory board members, and we have a really amazing board. I think we've got a wide variety, diverse group of people with a lot of experience and knowledge in different areas. For instance, Sabrina Walker-Hernandez, she's Miss Nonprofit World, right? So she and Sister Pimentel, who everybody knows and loves and respects, we're going to head up nonprofit and faith-based. Barry Patel, everybody knows Barry, was mayor of South Padre Island. Barry owns the Embassy Suites, very much in the business world. He was going to help with the business cluster. I was going to help with the education cluster. Manny Vela with the healthcare cluster. So we were able to bring together different clusters headed up by different folks. Mark Moran in the mortgage industry, right? He was helping on the business one as well. And, of course, Todd Mann. Todd was with South Texas Health Systems at the time. Todd also helping with the healthcare cluster. So we brought all these folks together, whether it was somebody from the county, like Eddie Olivares, to somebody that's heading up a healthcare organization, managed care, to somebody that's working in a hospital, somebody from the medical school. Really bring all these minds together and kind of say, what are we doing well? And what are we not doing so well? Who are we able to serve, and who is still being left behind? And then how do we get these services? Like things like you have mobile vans that are going into different areas. What's the follow up from that? How do we determine if the patient is doing better? How do we determine what needs are still not being met? How do we advertise? How do we increase the services? Because I think a lot of those are grant-based too. And you know what happens when the grant runs out? You just don't have anything. I mean, we see that through our medical school and through the university, because a lot of the things we do are via grants. But if there's no funding from the state or there's no grants that are coming in, you can't continue to service that. And so even when you're a nonprofit, we're not looking to make a profit off it. We just want to have enough to be able to service all these individuals. So I think by having these cluster groups, we really had our eyes open to a lot of the things that are being done. And then Rashmi went before the COG, the Lower Rio Grande Valley Development Council, to give them a little bit of background on herself and also what AltaCair was. And while she was there, Patty Rosalind with Easter Seals was also there. Well, Easter Seals helps children living with disabilities, and they help anyone, regardless of your ability to pay. And so you're able to see, here is a service that I think a lot of families in the colonias probably have these needs, but don't even know that these services exist, right? Or that they can get access to it. Not that Easter Seal isn't advertising it, but they can only reach out so far, or they reach out as much as they can. And there's a certain group of people that learn about all the services nonprofits have available, and yet so many that do not know about the services nonprofits have available for them. So the idea was to start trying to spread the word so then we can connect, and kind of like what Vida does also. Vida is such a great organization. They are helping with wraparound services for people that are trying to get their education and continue and get a better job, right? And yet those services may not be known about by folks living in the colonias. So a lot of this is really getting input from organizations and then being able to spread that word.
Well, I would argue as well, if you did nothing else, just by bringing those clusters together, bringing the folks in those meetings together, they got to talk to each other.
Yes.
Get to learn who is who. I mean, their names, they probably know of the name of the group,
yes,
but they never connect. It's one of the complaints that we've heard over the years, that all the different groups work in their own silos. And here, maybe for the first time, AltaCair brings everyone together. That, for me, was fascinating.
Yeah, we want to be the glue. And I mean, just like, for instance, when we headed up the education, when we had someone there from TSTC, we had someone from TSC, we had someone from STC, all the alphabets, UTRGV, A&M, everybody was there at the same table. And when you do that, it's not like no one's trying to get an advantage over somebody else. It's about, what are you doing that can help these folks? And how can we all, share the information that we've learned, and how can we all work together to make sure that we're taking care of those who can at least take care of themselves? Because I think most people, nobody wants to be disadvantaged. People want to work. People want to make a good living. They want to have opportunities. A lot of times they just don't know how to access those things that are going to help them get to the next level. So things like college nights. How do you help a parent that never went to college understand how their child can get in, or to get into a community college or get into a trade school, right? Having those, the ability to be that glue, that gap, to fill that gap, I think can make a big difference for a family. And as Rashmi brought up, one of the things she admired about the Valley was the family unity, and the fact that we care about each other, we want to help each other. I mean, that's something I see all the time at the university, that our students have a good work ethic. They're trying to do better, not only for themselves, but for their entire families, for their extended families. They have a lot of gratitude for opportunities that are given to them, and for the kind of aid that is available to them. And really it all revolves around their family. They want to make their families stronger. And that's what AltaCair is trying to do, is make families stronger.
And another aspect of what they're doing there within those clusters is you're trying to ensure that there's not a duplication of effort.
Yes.
So one group can chime in and say, well, actually, we do that.
Yes.
And that saves another group from saying, okay, we're going to go into that. Because we just don't know.
Right.
Lots of people don't know.
The left hand doesn't know what the right hand's always doing.
So
right?
that's another byproduct of what AltaCair is doing, perhaps.
Yes, we talked about, of course, we're just getting started, but we talked about ultimately even having a guidebook or something that is available where people can say, oh, if you live in this city, these are the things that are available. Or if you live near this one, here's where you can call or go to, how you reach them, right? And really, I think it's going to be informative also for the people that are providing the services, not just for the people that need the services, but for those that are providing, to say, gosh, we totally missed this particular neighborhood. We did really well with Cameron Park. Cameron Park was a colonia that for many years did not have all the roads and all the things they have now. Now Cameron Park is in pretty good shape. Las Milpas was that way. Now Las Milpas is in a lot better shape. One of my first pieces of legislation when I was a state rep was about having lighting in the colonias, because people were doing without lighting. People are still doing without lighting in some of those colonias. People are still doing without transportation, bus stops, without having the sometimes adequate water, drainage, all of those things. And then informing lawmakers and other policymakers about where these gaps exist, so then they can go and they can advocate for these areas that they may not be aware of, have these needs that are still out there.
Mm. So for myself as a journalist, I've always thought that communication's one of the biggest problems here. So your suggestion today, and you're obviously talking about it in-house, of having a guidebook, electronic and print, English and Spanish, and for something like that to be in every home.
Yes.
I think if we were in a big city, that would be there. We would have that, but because all the communities are separated,
we are a big city. If you think, we are 1.3 million people at least in the Rio Grande Valley. That's not even counting people from across the border that are here, or people that come on a daily basis back and forth. So we are a really large area. We just, a lot of times, I think, get pigeonholed into, well, you're this part or you're this city. But really, we are one large region. And I think you've seen more and more of an emphasis now on one region one voice, everybody coming together to try to advocate for the things we need as a region. And I think this will help us also as a region to take care of those that most need the help.
So you are actively considering such a document, such a handbook with an explanation as to a list of all the groups and what they do and how they can help.
And how they can help.
That would be a first for our region.
I think so. And I think it would be, especially because once Cameron County is very different from Hidalgo County. And so a lot of times people that live in Cameron may know what's there, but there may be a service that's missing and they don't know that it's available in Hidalgo or in Willacy or Star or, so I think it's really having those services available and then looking for ways that some of these nonprofits can collaborate with each other to then provide a service. And we run a nonprofit resource center at the university. We're always looking for ways that the nonprofits can collaborate with each other and then also to give our students the opportunity to go out into the community and actually do work in the community, make a difference in people's lives, not just sit in a classroom, because I think you do your best learning when you're out there with your feet on the ground.
So in our conversation with Rashmi, she gave a shout out to TRGV and the data that you've collated about the colonias, but I didn't ask her just how many we've got, but I think you've got some of that.
So
they're growing fast, aren't they? They're still growing.
They're still, unfortunately, we haven't, the day I know that Richard Cortez wants is the day we have no poverty, right? And I mean, it won't be in his lifetime, it won't be in mine, it won't be in any of ours, but I think we're all chipping away at that. So far, I think Dean Kine was the professor that did the study. And he showed that there was still, I think, 150 to 182 in the Rio Grande Valley that are considered red zones, which are the ones that are in really high need. But there's about 961 in the state of Texas. 400 to 425 of those are in the Rio Grande Valley. So the Rio Grande Valley does have the large majority of colonias. And, I think we can easily lose touch of that because we are blessed to be able to have good jobs. We go home into our nice homes. We have streets that are paved. We have sidewalks that are lit for at night. We can go walking. We can go biking, whatever. You can go a few miles down the road, and you don't have that at all. And so people are doing without a lot of the basic needs. And basic like broadband. Nowadays, broadband is no longer something that is a luxury. It's a necessity. And you can access a lot of health care even via the telemedicine. So can we expand broadband so that we do bring it to that last mile of people that really need it? Can we help to advocate for that, make our lawmakers aware of it, that, hey, these are areas that are still without. And because of that, the students are not doing as well. The parents are not doing as well. They can't access certain services. Yesterday when Spectrum went down, everybody didn't know what to do, right? Everybody's like, oh my gosh, I can't imagine going through that every single day because you don't have access to any of these things. So.
Right. You mentioned lawmakers there. So this question just comes into the top of mind. Do you think AltaCair will have a legislative agenda? Will you have a wish list that you'll go to the state legislature with early next year and say, these are the holes, these are the gaps that we have in the valley. We need help with this or this.
I don't know if we'll get there for this coming session because, as you know, it's right around the corner and we're brand new. But I think that by the following session, we're going to have a lot more information about what we need to be pushing for and have an agenda. Right now, I know Rashmi is in the process of looking for grants and writing grants. I mean, she's pretty much a one-man show at this point, right? A one-woman show. And then we have a young lady, Samantha, that's been helping her almost pro bono to do a lot of the marketing. But like anything else, this takes money. And
so an immediate shout out for the donors out there that are watching.
Yes.
Please give us a call.
Well, also, we know that people want to get something for their money. So we've got a fundraiser coming up. We're doing a Casino Royale, because everybody seems to have fun at those. It's not a lot of speeches. It's more about fun, but to benefit this wonderful cause. And that's going to be on August the 29th. So we're getting the word out right now about this coming casino night fundraiser. It'll be a start. That gives us enough seed money to help us with the work, wonderful work that Rashmi and Samantha and Edwin and others are all of our board are trying to do. Nobody's getting paid to do it. Rashmi, we need to be able to give her some money to get paid so that she can do this work. But none of the board members, we're all volunteers. We're all doing it because this is near and dear to our hearts.
And have you got a venue for that yet?
Yes, we do. I'm trying to remember where exactly we're doing it.
Well, if not...
Embassy Suites. What am I saying? Embassy Suites. Barry Patel has been a wonderful donor and has let us have meetings there, and he has offered the Embassy Suites.
You couldn't have picked a better venue.
More beautiful place. Yeah,
absolutely. Good. Well, is there anything else you would like to add, Veronica, about AltaCair's work and that stellar board that you have?
Well, I couldn't be part of a better board. I mean, the individuals that are part of it are people that are well known in the community, that have been working all their lives to try to help others. And I think that's, we're all in it with the best intentions to help our neighbors to do better. And then we have a great executive director in Rashmi, because she truly believes it. She's seen poverty as a child. She saw it in Mumbai. Moving to the Rio Grande Valley, she realized, hey, it hasn't gone away. It's here. And then what a great time to do it with this prosperity task force that the judge has put together. I think everybody's kind of on the same page right now. So the momentum's there, and we have to build on it.
Well, thank you for coming into the studio, Veronica, and telling us more about it.
Thank you, Steve.
Very pleased to see you.
Well, it's good to see you always. Thank you.
Thank you.